Hey, how's it going, all you awesome ladies? Welcome to Wellness Wednesday tonight. Today, I don't know about you, but today has gone by really fast. It's just one of those days. I mean, I guess when you're so busy and you've just got so much going on, and the days just rush by, and it is, I don't know, it's just crazy how fast time flies sometimes. Today went really fast for me. Anyway, I very different than the topic that we're going to be discussing, of course, with constipation. I know, not a very glamorous topic, but while we're waiting for our ladies to jump on, anyone else who wants to get on tonight for this discussion, which I think will be interesting. Um, let's make sure everybody can hear me and see me okay. Looks like we're good. Very good. So let me say my disclaimer and we can get into this. So anything that I say tonight during this Wellness Wednesday is health information and not intended to be any health advice. Uh, don't start taking or stop taking or change the way you're taking any of your medications. If you feel like you need to do so, please first consult with your prescribing practitioner so they can help you make the appropriate adjustments. And attending this Wellness Wednesday does not establish a doctor-patient relationship. All right. So this, you know, I know it's not a very fun topic to discuss. However, it is so important. This is so common. This symptom that we have, this constipation. So many of us deal with this even from childhood. Remember, any symptom that is your body's way. Your body gives you symptoms because this is your body's way of telling you that something is not right. And constipation is a symptom, just like a headache or joint pain or high blood sugar or depression or anxiety. It is a symptom, and it has a cause. And who knows how many, right? Any digestive issue, you start to kind of think, okay, diarrhea, constipation, bloating. These are all symptoms your body gives you to tell you something is not right. And so, okay, how do doctors handle these symptoms? Well, oftentimes they just suppress the symptoms, and they're really not addressing any root causes for this constipation. And let's get a definition going here. So it really has to do with frequency of bowel movements more than anything. It's not about consistency, but frequency. So decreased frequency of bowel movements is the definition of constipation, just like the definition of diarrhea is increased frequency of bowel movements. It doesn't mean, that's why you then throw in the descriptors, right? Watery diarrhea or loose, with constipation, it's just you're not going as often as you should. Well, what's normal? Normal is 2 to 3 bowel movements a day. You should actually have a bowel movement stimulated by your meals. You should wake up in the morning and normally have a bowel movement after you wake. This is normal. All right. Now, when you're going 4, 5, 6 times, that's going to be diarrhea, regardless of the consistency, and so if you're only going once a day, does that mean you're constipated? A little bit, because again, it is normal for us to just think, okay, as long as I'm going daily, then I'm good. Doctors handle this. They definitely don't do anything if you're having a bowel movement every day. They're going to tell you, yeah, you're fine. If you're not fine, then they're going to give things like magnesium and laxatives and just band-aids really to override your body's physiology and make it help you empty yourself, but that's not really solving the problem. Are there more natural things? Of course, so let's talk about colonics and enemas. Well, these are also band-aids because they're not really, I mean, they're helping you to evacuate, but it's not really ever solving the constipation issue. So instead, let's look at the many root causes for constipation. So the first thing is liver dysfunction. When you have liver dysfunction, your digestive tract, first of all, as you might know, is a huge part of your detoxification pathways to eliminate toxins from your body. So if you are not eliminating toxins, if you're not going, then those toxins are going to reabsorb and perhaps even in more of a toxic form too, back into your system. And this can occur even when you're only having one bowel movement a day. If you, so liver dysfunction can cause constipation through a couple of different mechanisms. The first one would be your liver's not making enough bile to help with clearing out, the feces. You actually do benefit from making enough bile in this way, and then bile is also important for detox function. So it's the stuff from your liver that holds on to the toxins to usher it out, so to speak, or kind of handcuffs itself to the toxin so that it brings it out of your body. Well, once again, if you don't have enough bowel movements, enough frequent enough bowel movements, then you're going to reabsorb some of those toxins, and that's not going to be good. Now, the liver also, as you know, thyroid is really important for bowel function. And so when your liver's having trouble converting T4 into T3, or the active thyroid hormone, this will cause low levels of active thyroid hormone in your body, and this will cause problems with gut motion, the motion that it has to move digested food along. This is called peristalsis, if you wanted to know. So it's so important to keep things moving through, and so if you don't have enough T3, then and this is largely because the liver is not able to convert enough of that in your convert enough thyroid hormone for you. Now, if you have, the next thing is gallbladder insufficiency. So another reason why you would not secrete or release enough bile into your intestines. All right. So this has other consequences. You wouldn't be digesting fats very well, or proteins perhaps. But this, when it's really bad, then it's just when gallbladder insufficiency is really, really bad, that tends to go the other way. So we tend to forget that you need a little bit of bile to move into your intestines, to help your feces move along, and help you evacuate. Okay. Next one is, and this is, most of us know this, dehydration. Not drinking enough water will cause constipation. You must drink enough water. This will help your stools to be softer and able to move through easier. So you must drink half your body weight in ounces of good water, meaning either distilled water or highly filtered water with reverse osmosis filters, or at the very least, maybe zero water filters, but try to get the cleanest, best water. And then adding, of course, electrolytes back in is very helpful, to get your electrolytes and minerals. And I would say also, if you are over 200 pounds, 220 pounds, I wouldn't necessarily drink more than about 110 ounces in a day, even if you weigh more. Okay. So cap it at about 110 ounces. And this one's a no-brainer. We hear this a lot. Not enough fiber in your diet can certainly lead to constipation. So I'm not talking about grains, because we know the issues with grains. All right. We know that, especially, look, ladies, 99% of you have insulin problem, some sort of dysglycemia or blood sugar and insulin problems. This is so important not to have grains because of the fructose content that raises your blood sugar and causes more insulin resistance. And those of you who especially are looking to lose weight have to you're most likely to have an insulin resistance problem. So it's far too common. I see it in almost everyone. So eating grains is not going to be good. Of course, a lot of fiber is in whole grains. Nutritionists are going to educate you on getting enough grains. Whole grains, whole grain bread, cereals. No, that's not going to be the best source of fiber. All right. Your fiber needs to come from your vegetables. Eat your veggies, right? Most of your plate should be vegetables, and just a small amount, moderate amount of protein, animal protein. So we know that fiber is important because it adds bulk and increases gut motility, that gut motion. And we really need to focus on making your vegetables, really, 3 to 4 times, what your protein is for the best benefit. Okay. So, okay, some of you might have, might go toward fiber supplements. Well, a couple of things about fiber supplements. If they taste good, then it's probably not good. They're probably full of sugar, or at least artificial sweeteners. So, and the other thing is, too many fiber supplements adds too much bulk and actually can worsen the problem with constipation. So these are just a couple of things to consider. If you must, then sure, grab some fiber supplements, like psyllium husks might be a good alternative, but make sure it doesn't have anything else in it. Make sure, like Miralax, not Miralax, Metamucil is basically psyllium, but it has so many other added, ingredients and things that are so bad. So look at the labels and see what you're putting in yourself to really help with this constipation issue. So a low-fat diet is going to cause constipation. Hypochlorhydria, or not making enough stomach acid. You ladies with reflux and so GERD, heartburn, even just that. This, just know that having this state, being in this state of low stomach acid production is going to potentially cause constipation as well. Hypothyroid, the reasons I listed, I'm going to just list off several: food sensitivities, mineral deficiencies, GI infections, including SIBO, or small intestinal bacterial overgrowth. Dysbiosis can lead to constipation. Gastroparesis, which is essentially neuropathy of the gut. Inflammatory bowel disease, or IBD. Pancreatic insufficiency. Degeneration of the hippocampus is what we see in Alzheimer's disease. That alone can be a sign of constipation can be a sign of hippocampal degeneration. Medications. Now there's quite a list here. So opioids, NSAIDs. So these pain medications. NSAIDs would be like your ibuprofen or naproxen. Iron supplements, Benadryl, and drugs for incontinence, bladder incontinence. So antacids, antidepressants, and antipsychotics, anti-seizure and anti-Parkinson drugs, antispasmodics. What are those? They help with spasms, muscle spasms. So a lot of times doctors will treat inflammatory bowel disease where you're going too much with antispasmodics, and it can just throw you the other way, into the other direction. Blood pressure meds, especially calcium channel blockers, diuretics, which are your water pills, simply because they're going to dehydrate you. We talked about drinking enough water. Now, especially these newer weight loss drugs, these GLP-1 agonists, these are the ones that cause damage to the enteric endocrine cells in your intestines, which produce insulin and GABA. And when you lack GABA, this is going to slow down your bowel motion or motility. All right, this peristalsis. So you can end up with this gastroparesis problem. That's how that works. Dysautonomia is another cause. And there's just so many. Stress. Let me explain this one. So in the past, I've talked about parasympathetic and sympathetic. Well, when you're stressed and you're in, kind of fight or flight, and you're running from that tiger, right? It's chasing you, and you're not going to stop to go to the bathroom, right? This is how your body kind of sees it. So when you're in stress mode, you're not going to stop. You're not going to relax enough to empty your bowels. You need to be in parasympathetic mode to have better bowel movements. Parasympathetic mode is your rest and digest and repair. Rest, digest, and repair or heal state that you need to be in. And so when you're in fight or flight mode and in stressed out mode, it's not generally conducive to just stop and have a bowel movement. Okay, like I've been going and going all day today, and that's, I think, why it's just gone by so quickly. I've been going and going, and you're just not going to stop and smell the roses, right? You're going to not have. I know that's quite a juxtaposition for what we're talking about. You're just not going to stop and relax on the toilet very well, right? Did you think there could be so many causes? So if we're born to heal and you still have the power to heal, instead of just putting a Band-Aid on this constipation, we really have to dig deeper and analyze where the symptom is coming from. We have to get the appropriate testing. If you're not getting the right testing, then you're just guessing which of the many, 20 or more things that I just went through that are causing it. No, and there may be more than one as well that are really ganging up on you to cause this really, irritating symptom of constipation. And it's not good to be constipated. Like I said, you're not going to detox your body if you're not moving your bowels properly. And I know there's a lot of things you can do to, stimulate having a bowel movement to evacuate yourself. Caffeine seems to work. For some people, not all. There's natural, like laxatives, senna, and there's certain oils and just things you can certainly do to help you along, right? They even have, medications that are designed to help with this. And so, I mean, yeah, you can take a bunch of magnesium and all these different natural things. But is that really what the answer is? Or do we have to really focus on the root causes? All right. So if you've had this problem all your life, think about all that has been missed in your care so far, because no one's looking for the nutritional problems. No one's looking for, the food sensitivities, the thyroid issues, the insulin resistance issues, adrenal issues, or even like infections and other gut issues. Um, so many things uh, are you know are at interplay together. They're so interconnected. As let me kind of talk about a couple of those other things on my list. Um, so food sensitivities, when you have these, this is going to promote a a sympathetic response, and you're going to be in stress mode, and it's going to it's going to impair your ability to evacuate your bowels. um, it's going to cause undigested matter to go in through and inflame your intestines, and the more inflamed your gut gets, um, the less it may want to move. So what about infections? Gut infections, you'd think, well, typically, shouldn't you have diarrhea with those? Well, not all of them. Not what I found most of the time with our, as we do stool testing, with all of our patients, okay, every new patient, we order a stool test for them because we're looking for those hidden infections, and this is the first best place to look. Um, and so some of the infections actually that we're seeing are more than likely going to promote constipation rather than diarrhea. Um, so the the really important thing is the focus has to be on getting the right testing and finding where in the world are your imbalances that are causing the symptom. And when I spoke with a patient the other day, Brenda, she had never known that not going every day wasn't normal. Going a week without a bowel movement was not unusual for her. How could she, you know, at least as far as she could remember, throughout her life. Now she is going once to twice a day, usually twice. So she's in a much better place now, and she's feeling a lot better in so many other ways because she's able to detox properly. Your detoxification pathways need to be open. And that's also why with our treatment, individualized treatment plans for our patients, we don't start trying to detox, especially when patients are having trouble moving their bowels regularly and, not more than once a day. So if they are able to move the bowels, more than once a day, 2-3 times a day, then that's a good indication that we can get into detox and push that so much better. One patient had so many gut issues with colon resections due to inflammatory bowel disease, pancreatic insufficiency. She was happy if she went once a week, as sometimes she would go longer than that without a bowel movement. Can you imagine? I mean, I can't imagine. That's never been the case with me. thank God. So it was really important to find out her food sensitivities and insulin resistance issues and thyroid and adrenal issues with the right tests. So that's why this is so important to get the right tests and find out what is at the root of this symptom, or any symptom that your body throws at you, anything that your body's trying to tell you that something is off balance. You've got to pay attention to it. Just know that there are or reasons for it. Okay. Well, I thought I would go through and answer a couple of questions. And so I do have a couple marked here. Does being mobile also help move things through the gut? Well, of course. Thank you. Who is this? Let's see. Who asked that? That was Emlyn. So thank you so much. That's, I don't know why I didn't think about that. Well, certainly being mobile does promote, moving your bowels better. If you have a desk job and you're constantly just sitting, that is not going to promote healthy bowel function. So yes, get up and move around a little bit. For me, this is what I do to stay, I think, to enhance my parasympathetic function, right? My rest, digest, and repair function. I wake up every morning and I do some sort of parasympathetic work, whether it's a meditation or prayer. I mean, I almost always remember prayer, reading something, these are, this is all helpful, like a deep breathing exercise. I will often use heart math. Heart math is a biofeedback device that's really good. If you have trouble with meditation, heart math is a nice little device that we actually make sure all of our patients get one as part of their customized care plans. Or you can go to heartmath.com and see what they purchase one. What it does is it helps those of you who might have trouble with meditation to kind of give you some feedback as you're doing some deep breathing in relation to like your heart. So it really is helpful to get you into more of a parasympathetic state. So yes, that is something that's really important that I do, and just kind of probably should do more of this, but getting out and walking a little more. But I do try to get up from my desk. I often stand at my desk because as it's a standing desk, and so I will often stand and just move while I'm talking with people. And so, yeah, staying well hydrated. I always keep my water jug at my desk, making sure to get the water that I need every day. And so yeah, these kinds of practices are so important for me to stay in that bowel regularity state, because it's so important. Bridget asks, can parasites give you constipation? This is a great question, Bridget. Thank you for bringing this up. There are certainly some parasites that will constipate you rather than keep you, get you moving. There are some that will make your bowels move more, and some parasites certainly can slow you down. Yes, for sure. Let's see if there's any others. Yeah, it's really important, like I said, to be sure and get the right testing. Now, I'm often asked, okay, what kind of testing do you do? And what, how do I get this testing? And I'll just say that, just be watching for the next upcoming masterclass, because uh, until I do another masterclass, my schedule is closed and I really can't offer any testing and until during the masterclass, just a kind of a hint. So you might make sure to just watch for that, watch for the announcement, because it is coming up in in the next month or so. So be watching for that announcement. But the testing that I do, it's got to be so comprehensive, because we've got to look at so many of these systems and so many of these problems, potential problems that we can have that can cause this constipation and so many other symptoms like fatigue and brain fog and depression and anxiety and insomnia and so and certainly any other digestive type issues. We've got to look at a full blood panel where we're looking at all the different systems, your liver and your immune system and your kidney function and your insulin sensitivity function, and so blood sugars and we're looking for inflammation markers and adrenal function, and your analysis also tells us so much, and we're gonna be looking at all these important systems to tell us what is going on to cause this and so many different symptoms. Okay, I'm going to scroll down to the end just to make sure I don't see any other questions. There is one more. Does too much protein cause constipation? So yes, it can, especially so because you're lacking fiber usually when you are eating too much protein, and that could certainly be a cause of of constipation. So like I said before, if you're really careful about not getting too much protein, but making sure to get enough vegetables, around 3 to 4 times as much vegetables as you have protein, then you're going to be much better off. Most of our patients are able to get into a regular bowel habit, right, where they're not dealing with constipation anymore. It's so important, especially when we are really trying to get the toxins out, because toxins certainly will cause constipation as well. It's another cause I missed. There's so many. There's just so many. And then Darla asks, does age make a difference? Only insofar as what underlying imbalances have been perpetuated longer. It's not because you might be older that you have constipation. That is not why. The reason is you've been aging with these imbalances for so long, and those imbalances get worse. Hypothyroidism gets worse, especially when you have an autoimmune condition causing, called Hashimoto's. Insulin resistance will get worse, and the pancreatic insufficiency gets worse. If you don't address these issues, then of course it'll seem like it gets worse with age. Well, that's why. It's not the fact that you've added birthdays. All right. Okay, I think that is it for a question. Oh, one more. Thank you. Nope, I think that's it. Great questions. Uh, remember the importance of getting to the root causes of this and many other symptoms that you have. That is that getting the right testing is so important, and because we all have the ability to turn these around, right? So remember, have hope. There are answers, yeah, and you still have the power to heal. Ladies, have a wonderful evening. Take care, and we'll see you very soon.